Hansen's disease is caused by a germ known as Mycobacterium leprae. This germ was first identified by Dr. Hansen, and therefore the disease is also called after his name. The disease is mostly acquired through inhalation. However, only 15% of cases can pass on the germ to others. On the other hand, more than 99% of the population have adequate natural immunity against the germ. The germ primarily involves the skin and peripheral nerves. In some cases, the germ may reach the inner lining of the nose and throat and result in stuffiness that does not respond to usual treatment. For almost 40 years, we have an effective treatment for Hansen's disease. Within days of taking a single dose, the germs become incapable of spreading to others. Therefore, the threat of catching the disease comes only from those cases who are still not on treatment and not from those who already are on treatment. Yet, Hansen's disease is still with us. Every year, on an average, 200,000 new cases are detected worldwide. This means every 2 minutes, someone, somewhere in the world, is being diagnosed to have Hansen's disease. This adds up to 1 million new cases every 5 years. In Trinidad and Tobago too, we have on an average about 25 to 30 new cases every year. Lack of awareness that the disease still exists and how it presents itself in the early stages are the two main reasons for missing the diagnosis. Stigma, prejudice, and discrimination prevent the patients from seeking treatment. Delay in treatment can lead to permanent disabilities and further social isolation. Delay in treatment can also lead to spread of the disease, though the disease is only mildly contagious. Remember, early treatment prevents permanent damage and also prevents spread of the infection. The next few slides show the usual manifestations of Hansen's disease. Watch these clinical pictures carefully and help us detect new cases early. The initial lesion may be light in color, or the initial lesion may be reddish in color, but these lesions do not respond to the usual treatments. Compared to the normal surrounding skin, the patch of Hansen's disease may appear more dry, have less number of hair, and may have reduced or absence of feelings. A patch that has reduced or absent feelings is diagnostic of Hansen's disease. Left untreated, the edge may broaden and the lesions may resemble a ringworm infection. Without treatment, the lesions may even become large in size. In some cases, the entire lesion may become raised. Those who have a very weak resistance against the germ may have raised round buttons all over the body. Lumpy swellings of the ear lobules is highly suggestive of Hansen's disease. When nerves are affected, they become thickened and at times even painful. Thickening of the nerves is very characteristic of Hansen's disease. Involvement of the nerves of the legs may result in loss of feelings on the feet. The person may get repeated painless injuries and burns. Involvement of the nerves of the arms may cause loss of feelings in the hands and result in repeated painless injuries and burns. Damage to the nerve supply to the muscle may result in muscle weakness and wasting. In some cases, loss of muscle power may prevent the straightening of the fingers. Remember, Hansen's disease is curable. Treatment is easy and free of cost. Full confidentiality is ensured. Early treatment prevents the spread of the disease, and early treatment prevents permanent deformities.